Welcome to another episode of Manversation. This month, we're diving into a topic that is especially significant during October, men and breast cancer. As always, we appreciate your support, so be sure to subscribe to our page, like, and share this live session. Don't forget to engage with us in the comments. Today, we have three special guests joining us. And just because it's Manversation, we always have an amazing woman on the call as well. Hint, hint, Tamika. All right. Let's welcome our guest, Rodney Jones from the Leukemia and Lymphoma Society, Mr. Long Island Iced Tea himself, Mr. Travis Douglas, a male breast cancer survivor and the founder. Oh, no, he's not the founder, but he knows the founder, which is Tamika Hunter Ross, a stage 4 metavivor breast recognized organization. She's the one that, believe it or not, when we start to have our conversations, we kind of got to, put our cups away because Tamika, knows what it is. How you guys doing today?
Doing good.
Doing good.
All righty. So I'm about to, just let you guys introduce yourself very quickly. Tamika, don't take all day. We're going to start with you, Rodney Jones. Tell us about yourself, sir.
Well, James, thank you so much for having me. I appreciate this opportunity. I'm Rodney Jones. I'm with the Leukemia and Lymphoma Society. I'm a community outreach leader, and I implement patient and education programs to support the LLS mission, which is to cure all blood cancers and improve the lives of patients and their families.
All right, Mr. Long Island. Travis Douglas, tell us a little bit about yourself, sir.
Hello, everyone. Thank you for having me. My name is Travis Douglas. I am part owner of Resilience Beauty Box, a hair salon located in the Columbia, South Carolina area, and I'm a breast cancer survivor.
Awesome. Thank you for having with us. Tamika Hunter Ross, troublemaker, chipmunk. Come on through.
Good evening, everybody. I am the one and only, no duplication, Tamika Hunter Ross from Sumter, South Carolina. I am the founder of Face Strong Nonprofit and Face Strong Breasty Support Group, and I am a stage 4 metavivor thriving since November 5th of 2018.
All right. It's November what, Tamika?
November 5th, 2018 will be 6 years of this diagnosis.
That's
and I'm
what's up.
still here.
That's all right, sister. That's all right. I like to hear that. Thank you all for those wonderful introductions. Now let's dive into our conversation for the evening. Travis, step forward to the congregation, please.
All right.
As a male breast cancer survivor, your experience is pivotal in today's conversation. So can you share a little bit how it felt to be diagnosed with a disease often associated with women?
Well, honestly and truly, I was very shocked because the knowledge that I had of breast cancer in the past was that it was a disease that was known to be a genetic type situation. So I never thought in a million years that I would have been diagnosed with breast cancer. Also, just dancing around the idea of calling my chest a breast was one of the hardest things that I had to kind of come to grips with as well. Like I watch a lot of surgery shows, and of course I worked out a bit much with trainers. And so you just never hear men calling their chest breast. It's always your pectoral area or your chest. But to associate my chest with a breast, that was a bit much for me as well.
It's eye-opening. Especially that first inclination when the doctor says you have, and it's like, well, wait a minute. It's a different feeling. It's a different description, isn't it not?
Absolutely, yes.
Gotcha. Thank you. Rodney, as a community advocate, what do you believe is the most important message to convey about health awareness in general, especially regarding cancers that might affect both men and women?
Well, James, I'll tell you, I think that one of the things I hear when I'm on the road in the community is that people don't understand the importance of self-advocacy. They don't understand the importance of going to see a doctor and making an intelligent and responsible decision to advocate for your health. I look at it like this. That car you drive, that BMW that you drive, that Ford that you drive, nobody's going to take that to the dealership but you. So you got to take care of yourself. And, we know that knowledge is power. I cannot tell you the amount of times that I've been standing behind a table or speaking at a health fair and somebody says, I haven't been to the doctor in years. And they say it with a sense of pride. And the unfortunate reality is, African Americans, especially men, are diagnosed later in life, and then they have less access to treatments and they know less about resources. So it's incredibly important to advocate for your health, to make an intelligent and responsible decision to fight for your own health and well-being.
Man, you just said a mouthful right there, especially with African Americans and that later greater recognition of actually doing something about it. That's something that I guess we got to do better about. Tamika,
Yes.
you created an incredible organization in Faith Strong Incorporated. Can you tell us how you came up with that name and what it represents?
Okay, so how I came up with that name, for one, I am pro Jesus Christ.
All
I
right.
am a woman of faith. I am a believer. When I was diagnosed the second time with breast cancer, with stage 4, I was looking for a support group. Could not find what I was looking for. Everything that I was, coming in contact with, it was like a pity party. Woe was me. Everybody was complaining. And I'm just like, nah, this is not for me. And especially also being a minister, I'm just like, I got to, I need something that's going to feed my spirit. Well, I couldn't find that. And I heard God speak to me so clearly, said, you start what you're looking for. And after losing my dad and 3 of my dead brothers, we lost 4 family members, with my dad being the 4th brother to die within a 9-month period from cancer. You can't even imagine what was going on in my mind by the time I was diagnosed, after dealing with 4 deaths, including that of my dad, and watching him take his last breath from cancer. And not only did God say, start the support group, he also said, you got to remain faith strong. And that's my hashtag, that's my motto, that's what I live by. And that's what I encourage everyone that is part of this support group, that no matter, what you feel like, no matter what you're going through, the life expectancy for someone with stage 4 is 3 to 5 years. It's 6 years for me and I'm still here. Doctors cannot tell me and dictate when I should live and when I should die. And so therefore, I just live by faith every day. I mean, basically just what the word of God said, we got to remain faith strong in this and through this journey. There's no other way.
Now, Tamika, you hit on something real interesting right there. You were talking about stage 4. We hear a lot about stage 3, stage 4, stage. What is that all about? Educate my listeners on the different stages of cancer, if you can.
So the first time I was diagnosed was April 30th of 2015. It was like stage 0. It was like, the size of a pebble. It was just on the onset. So we caught it in the beginning of it. And so I went through the lumpectomy, had 40% of my right breast removed. And then I did radiation for weeks and went through the 3 years. And then on that 3rd year, I started noticing something was different with my body. And, of course, they put you on medicine. The medicine that they had put me on, which is a blocker to prevent it from coming back, also caused me to have what is called a TIA stroke. So when they took me off the medication, the blocker, they didn't put me on anything else. So it increased my chances for reoccurrence. Another thing that contributed to my reoccurrence is obesity. Especially among African American, we love to eat. We eat every part of the pig, the cow. A sister like to eat, but then a sister don't like to work out. So, so let's just keep it real. So not only did, not being on a blocker, also being obese, that was a contributing reoccurrence. Another thing that contributed to my reoccurrence is that I was on birth control most of my life. I started birth control my freshman year in college in 1992. Okay. So from 1992 through 2007, I was on birth control, feeding my body all these things that increase the chance of breast cancer, which a lot of people don't know that. So there was a lot of factors that contribute to the reoccurrence. So when it came back, basically it spread it from the outside of the right breast into my bones. And then when I started going to Atlanta, I found out that not only did it spread to my bones, it had spread to my lymph nodes, my lungs, my liver. So after 6 years, right now, we still see spots on the bones. There's also spots on my lower lumbar,
Yeah.
and the tumor derived from my, what is called, I would say, my tailbone. So basically, stage 4 is when it comes back, it spreads outside the breast. It can go to, lymph nodes, bones, liver, and even to some instances, it can go to the brain. The doctor said there's no cure for stage 4. That you will have to do treatment for the rest of your life. With me, I do treatment every 3 weeks. Last Monday, I did chemo number 94. Some women, it's every 2 weeks. Some women, unfortunately, don't have to do it every 3 months. But basically, stage 4 is mean that it came back, it spread to other parts of your body. There's no cure for it. You have to do treatment for the rest of your life. We do have a few women in our group that their first diagnosis was stage 4.
Wow.
They kept complaining to the doctors that something was wrong. Oh, you just got dense breasts. Oh, it's just that, just that. And then by the time they started running tests to figure out what was really the root of the problem, here they are, diagnosed with stage 4 breast cancer for the very first time.
Wow, wow, wow. That's a powerful story. A powerful story. And a small disclaimer: Manversation is not against anyone using any type of contraceptives or prenatal vitamins or anything along those lines as far as treatment for not having kids, because some of y'all don't need any kids. Moving on. Mr. Travis, come to the front of the congregation, please.
All right.
Travis, did you feel that you received the same treatment from healthcare providers as female patients? And second caveat too, were there any challenges you faced during your treatment?
Honestly and truly, I can't really say that by comparison that I was treated differently from I was a female. But I will say my experience was really good. It was very fast paced. Like once I was able to get into my doctor's appointment and I got examined, everything was immediately. It was like they sent me out to go get the mammogram and the sonogram, and then they did the biopsy like the week later. And of course, I was diagnosed with breast cancer in December, but then it was like, okay, well, let's set you up with this and let's set you up with that. So I must say that the transition was actually quite pleasant. I didn't have any pushback from my doctors. They answered the questions that I needed them to answer, and they were very thorough. I will say my surgeon that did my procedure, he was very stoic. So he wasn't one of those people that, I wouldn't say he didn't make me feel comfortable, but he was just one of those people. I guess he did this so much, it was not normal for him. But other than that, I must say it was very pleasant. Even having my nurse navigator, whenever I would call her, she would call me back. She would answer questions that I would need. Like it was a very pleasant journey, I must say. I would say the only challenge in this process for me probably was the chemotherapy. But other than that, the surgery was fine. The healthcare providers were fine. And, thankfully, even thank God we got to meet on here, but I had joined their group, and, just speaking with those young women in that group, they were able to give me some valuable information to even ask my doctors and oncologists while I was going through this process. So they kind of gave me like a little cheat sheet. So that worked out wonderfully.
Travis, Tamika, she mentioned it, and you just mentioned it as well when we're talking about chemotherapy. To the best of your ability, Travis, man, help my audience understand what exactly is that and what does it entail?
Well, chemotherapy, of course, is it's a fluid that I was taking, and actually I was taking two fluids. I don't remember the name of them right off the top of my head. I should have wrote them down in my notes beside me. But however, my chemo was basically a preventative for my cancer, not for all the cancer to be cleared out. So it was like, just in case they left anything behind, they wanted to make sure that they killed it just in case. If any cells was left behind, they wanted to make sure that it was killed. I did chemo 4 times, and I had to do it like every 21 days. Chemo, it wore me out. I must say that was the most challenging thing I probably ever experienced in my life. I lost my taste buds. I was very sore. I couldn't work the week of. I lost my eyebrows, my facial hair, my nail beds. They're still recovering, but they started secreting and smelling. I gained chemo weight. I had foggy thoughts, like my brain, like I would go and order food and forget what I ordered. I went to go take care of some business for the salon at the border cosmetologist place. I forgot why I was there. So it was very, very much so challenging. I promise you, I don't wish on anyone.
Man, that's a lot right there. Definitely. Thank you, Travis. Rodney, how important is it to create a supportive environment for all cancer patients, regardless of gender, and what steps can be taken to improve this?
Well, I'll tell you what, James, that's a very good question. And let me just say that I think Tamika Ross just said it all when she talked about Faith Strong. I'm encouraged. But when you talk about organizations like Faith Strong, the Leukemia and Lymphoma Society, Sisters Network of the Triangle, the Duke Cancer Institute, those are organizations that will give you resources, that will give you education. For example, with the Leukemia and Lymphoma Society, we've got resources such as peer-to-peer support, our family groups, our clinical trial support center. You can get resources, financial information. So it's really important to be a part of those organizations. And I want to just say that, we had a patient education program in Raleigh, North Carolina last week, and I was one of the facilitators. And what I wanted to do, this is how important a support group is. I wanted to wrap my arms around those 70 people. They were cancer patients. They were blood cancer patients. They were in treatment. As Travis talked about, they were going through therapy. And I wanted them to know that they weren't alone, that you're not fighting by yourself. And I would say to anybody that's listening, join an organization, whether you have cancer or not, because you can volunteer. You can participate. Maybe you can donate. You can create a team. For example, we've got something called Light the Night. You can create a team and help raise funds that support research, that supports somebody getting access to funds to care for themselves, to care for, to take care of those cancer bills, that travel assessment that you need when you're going to MD Anderson in San Antonio in Texas, so that you can get the treatment that you need. You can help. So those groups are very important.
Nice. Right off the head, do you know where can my audience go to find out information on how to become a part of one of those groups or one of those organizations? Because I think that's some great information.
I think any website, but let me just say that we have something called the Information Resource Center at the Leukemia and Lymphoma Society. It's called the IRC, the Information Resource Center. I'm going to shout this number out. It's 800-955-4572. I'm going to say it again, 800-955-4572. That's the Information Resource Center, where you can get information and resources on all cancers, not just blood cancers, not just breast cancer, not just testicular cancer, but all cancers, because cancer is cancer. And I'm not a patient, but I support patients. And we're all in this together. I want to let everybody know we're all in this together. It's going to touch everybody one way or another. And Tamika, you can correct me if I'm wrong, but it's going to touch somebody. Somebody's going to know somebody who has cancer. It might, God forbid, and spare life. It might touch somebody today, tomorrow, tonight. But you got to advocate for yourself. Find out. Go to the doctor. See what's going on. Ask the second question. I can talk about it all day.
Thank you, Rodney. But you just messed me up, man, because now I got to go off script a little bit. We talk about this thing called cancer, and this is open up to all the guests. And Tamika, I'm about to come back to you, but this is open up to all the guests. What exactly is cancer? In the African American community, as well as men over the world, all over the world, we hear so much about cancer, breast cancer, prostate cancer, leukemia, and all these other different forms of cancer in and of itself. But many of us don't know what exactly is it. What does it entail? I mean, is it something from your cells, or something in your bloodstream, or what is it? Who can answer that for me?
Well, I'll jump right in and say I'm not a doctor.
Okay.
I don't have a medical degree, but I can speak to blood cancers. Blood cancers are abnormalities in the blood, bone marrow, in your lymph nodes, and in your lymphatic system. So I'll speak about blood cancers, but it's just an abnormality. And when we talk about breast cancer, specifically in men, it's an abnormality in the breast tissue, and some of the signs and symptoms, which we should know. If you don't know, you gotta, that's what the purpose of this conversation is. You gotta go find out when there's discharge in your tissue, when there is, and Travis, you jump right in, but when there's discharge, when your nipple looks funny, it's just any abnormality. You got to find out about it, and that's why these conversations are so important.
Yes.
Mm.
And just to
Yes, and to piggyback off of
Travis, go ahead, Travis.
to piggyback off of what he said as far as discharge, the crazy part for me was I didn't have any discharge, discoloration, or any tenderness. It's just so happened I was taking a shower and I rubbed across my chest area and felt the lump. And that's when I went ahead and set an appointment. So that's why a good thing too is to guys make sure that guys and women make sure that you're checking yourself out.
And for me, I didn't feel a lump. There was no lump. I was just going for my annual mammogram, and they saw something and said, okay, we need to do some further study with that. So by me going to, it was formerly called the Cancer Treatment Centers of America in Newnan, Georgia. It's now called City of Hope. I've learned that, what it is basic. My understanding is that we all have cancer cells in our body. And when it breaks off is when it causes the cancer. Now, here's the thing. There's a lot of things that can cause it to break off. Stress, environmental exposure, obesity. There's different things that feed these cells that can cause it to break, and that what creates cancer. And these are things we do every day. I'm guilty in all of them. I'm guilty with the stress. I'm guilty with the obesity, not eating well, but I'm getting better. When you know better, you do better. Because when I met with Travis when we were introduced, and I found out he was a hairdresser, and I asked him, I said, well, was it genetic? He said, no. I said, it may be environmental exposure, which you be, doing hair and exposing yourself to the chemicals and things that with you doing hair. And I remember sharing with him, you may want to look into get like, air purification system in your shop, so that you can decrease your exposure to the chemicals as with doing hair. It's the little things that creates these issues.
Man, that is
so
awesome.
Let me just jump in real quick, James, because to me,
go ahead, Rod.
She said something that was so important, and so did Travis. Sometimes you don't even have signs and symptoms. When we talk about blood cancers, for example, some of the signs and symptoms of having a blood cancer, by the way, blood cancer is treatable, but not curable. And some of those signs and symptoms include dizziness, being tired and weak, bone fractures, things that happen on a normal basis. And sometimes we are very guilty, especially as African Americans. We will have some dizziness in the morning. We'll drink some water, take a Tylenol, and keep it pushing. You can't do that. If you feel any abnormality whatsoever, you've got to have a conversation with your spouse, your girlfriend, your brother, your sister, your cousin, and your doctor, and check it out. Travis talked about just taking a shower and, feeling an abnormality on his chest. You got to go check it out. I'm looking at everybody in this. You got to go check yourself out. You got to do that. You cannot ignore it.
Yeah, right. Yes. That's so funny you say that, Mr. Jones. I don't know what it is with our culture. A lot of us have a doctor in front of our name and really not a doctor. We didn't go to medical school.
Let me tell you
I don't know what it is about our culture. We'll diagnose ourselves in a heartbeat. Don't tell me no, child, that's not what it. I don't know why our culture is like
I need to talk to somebody who's wearing that white coat and has a stethoscope around their neck and a plaque on the wall somewhere.
Real talk.
My health is at stake.
Let me get back to you, Tamika. So, Tamika, in your experience as a stage 4 metaviver sounds like a superhero. What advice would you give to others who may be navigating their own cancer journey? I like that, superhero.
So, basically, is what we all say. First of all, you have to know your body, and you got to advocate for yourself, because can't nobody want it more than you. And I've even learned over the years that you don't have to accept what doctors tell you and what they say, you could be like, hey, no. I mean, because there's been times that I told my dad, wait a minute, something that ain't sitting right with me. Why are we doing this? Or, what is the purpose for this? And again, as we just said, when you know something is wrong with your body, you need to act immediately. Like right now, I just had chemo last Monday. And, after having 94 rounds of chemo, it can start creating other issues. And like right now, I'm having an issue with swallowing and with my digestion, with just, doing the ongoing treatment. So, I'm not going to sit here and try to diagnose myself and, say it's acid reflux, say anything else. I'm going to be on the phone with my care team tomorrow and say, listen, this has happened since treatment. This is not right. It never happened before. We need to run some tests. That's what we have insurance for. I'll tell them in a minute, okay, when the last time I had my PET scan? How often I have to wait? Okay, well, let's do this again. I'm not waiting 6 months or 9 months. Let's do it. If my insurance, I can do it every 3 months. Let's do it every 3 months. Let's be proactive. We can say and ask for what we want. I tell people all the time, the doctor walk out of a room for a reason, because they going in there researching, trying to figure it out themselves as well. So, if they figure it out, I could be figuring it out along with them too. Let me give you some advice and advocate for myself while you trying to figure it out. I mean, y'all don't know me. I'm a realist. I keep it 100. And that's the reality of what we live in. But when you know your body and you know something is not right and you know what didn't work before, then you need to speak up. Don't just accept everything that they say and ask why. And it's okay to get a second opinion. I wasn't happy with my healthcare in South Carolina. I travel every 3 weeks to Atlanta, take a 5-hour drive, because my health means that much to me. You get what you pay for is what I tell people.
Man, 5 hours from.
It's a 5-hour drive. Now my husband can do it in 4.5 hours. I call him Delta Airlines in a car. So. But it takes me 5 hours to get from something to Noonan, Georgia. 5 hours every 3 weeks for the past almost 6 years.
That's some dedication right there, man.
Yeah, my life is worth it. I'm worth
right.
that.
And you're right. You're definitely right. You are definitely right about that. So, ladies and gentlemen, let's open the floor for discussion. I'd like to hear from each of you about the current challenges facing men diagnosed with breast cancer, and how can we as a culture work together to address these issues. Who wants to start it off? Mr. Long Island Iced Tea, I'm nominating you. Let's go.
I will definitely jump in. So much has been said tonight that has been good, but knowledge is power. And the Bible said, my people perish for the lack of knowledge. If you don't know something, that's going to cause you to perish. It can cause you to die. And I want to say, I'm just looking at Sister Ross and I'm like about to jump out of this chair because she has set me on fire. You are worth that drive. Health is wealth. The most valuable thing I have is Rodney Jones, and I got to take care of it. And there are people, let me tell you something, that care about me and they want me to be here and I want to be here for them. So I've got to take care of myself. I would say to anybody, advocate for yourself. And I'm gonna hop on Tamika Ross one more time, because if your doctor is not doing his job, I pay Cigna and Aetna a lot of money to give to you, and you're gonna do your job in here today. When you go out outside this room to figure it out, come back in here and we're gonna have a conversation and I'm gonna ask some questions. And we're getting into a place where we can record our doctors and they cannot refuse you. They cannot. They can't, because what happens is we'll go in there and they'll say all of these things that go over our head, and you can call the Information Resource Center and you can ask somebody a question, but you got to really get that doctor to slow down or get somebody to go in there with you to take some notes and get as much information as you can, because you got to take care of yourself.
Yeah.
Am I talking right?
Yeah.
Talking right. Talking right.
And Rodney, I will just say this, I mentioned earlier that, when the first time I was diagnosed, I was put on a blocker to prevent it coming back. I was put on a pill called tamoxifen. And, they give us these medications and we don't ask questions, we take it. And again, it led to me having a TIA stroke. So when I did my follow-up, when I got released from the hospital and went to the doctor to do the follow-up, she was like, well, did you not read the pamphlet about the medication? I'm like, Excuse me, you're the doctor. That's your job to tell me what the side effects was. And from that point on, I've learned to, like, ask questions. Okay, why am I taking this medicine? What is it going to do? What are the side effects? Because that was an experience I don't wish upon anyone. And like I said, it was like the responsibility was placed on me versus my healthcare provider taking the accountability and saying, explaining these things. So, because I mean, let's be honest, when we go pick up our medication from the pharmacy, we don't read that pamphlet, all that information. After the first time, we stop reading it. So, they have a responsibility to make us aware of what these side effects and what it can do for us. So again, we have to advocate for ourselves, better than anybody else will.
Yeah, I want to say too. I think the crazy thing is when I was prescribed the tamoxifen, it's crazy that you say that you had a stroke. Induced by that. That was something that they didn't even mention that could possibly happen. The way that they explained tamoxifen, it was like, oh, the only thing that you will probably really experience is sweating a lot. That was pretty much it. And then it was like, and for women, they have to be concerned about if they want to have a baby. So basically fertility. But the side effect of you could possibly have a stroke was never mentioned. I actually went and looked up some of the other side effects and looked up some stuff on YouTube. And that's when I found out that it could cause joint pain, bone pain, and just all the other things that came along with it. Weight gain, and and once again, like I'm the guy that like to eat as well. Don't exercise as much as I used to, but I'm the same way. I like to eat and probably don't pick up all the right food all the time as well. But they didn't mention any of that.
Man, it's something that just hit me quickly. When Travis was talking, is when someone has been diagnosed with cancer, does their daily life change? Do they stop working a regular job, or are they still working a regular job? Do their activities, does their lifestyle, what's the difference in any of it? Because it's not like you wear a scarlet letter or anything along those lines that says, hey, I got cancer, like, no. But I mean, what changes about lifestyle, and is your diet change or anything along those lines?
Now, I will say for myself, I'm a hairstylist, independent contractor. So if I don't work, I don't get paid. When I was diagnosed, the thing that changed for me was doctor's visits. That was something that I didn't do a lot. I would go to my yearly, but going to a doctor's appointment almost every 2 weeks now to every possibly 3 weeks, and then it will end up running over. And the way my appointment booking system is, my clients would typically book anywhere from 2 to 3 months in advance. So I would have to move clients around, cancel some people out. So of course I would end up losing money and possibly have lost some clientele, and not saying that they were not understanding, but like if they can't get their hair done, they go someplace else. And I will say, after I got my surgery, I was out for 6 weeks. So that was even trying to move my appointment book around. And thank God I had some clients that were, just very dear and genuine to me. And we have such a rapport that they were willing to wait and temporarily go to another stylist until I was back up and running. And even during the process of chemotherapy, like I said, I would take that first week off of chemo because it was just so terrible for me, and I would come back in that following week, but I wasn't taking as many clients as I normally would because I'd be walking slow or just really exhausted, have to take breaks in between clients. It was a major change, and as I said before, I dealt with some swelling. So it was one evening I had called my oncologist while I was at work, and I told them I would come on my lunch break so they can check the swelling in my legs, because my legs had got so big. And so I had an appointment coming in, within another hour, but I end up having to go to that appointment and being there for about 2 hours because they immediately started running tests on me. So it also it threw my day behind because first of all I had to see the doctor and then I'm still running slow. So it was a bit of a challenge. It was a bit frustrating, I would say.
Yeah, and I to add to what Travis is saying, and Mr. Jones was saying earlier, it is so important to that I'm glad that we're doing this, make people aware. One of my pet peeves is you can't hold people responsible for what they don't know. So now people know. We really need to support those that are really going through, because some of us, like myself, you don't have a choice but to continue to work, keep pushing or whatever. Especially with me still working, one of the problems I'm having is because I choosing to still work is that I don't qualify for a lot of things. Anyone that's diagnosed with stage 4, you automatically qualify for disability. I'm not disabled, so why am I applying for disability? I want to get up and go to work every day. I want to continue to live my life as normal as possible, and then I have great health insurance through my employer that affords me to be able to travel out of state and get the care that I'm having. When we started this journey almost 6 years ago, we would leave on Sundays. My treatment would be 9.5 hours on Monday. We'll get up Tuesday, do another 2.5 hour treatments. We get on the road, driving back 5 hours. My husband and I both back at work the next day on Wednesday. That was my life, and that's still my life. Even last week, I left Sunday, treatment Monday, got back Monday night. I'm back at work Tuesday morning. I have an hour commute back and forth to Columbia every day. I have but that was me. Everybody's body is different. My oncologist encouraged me and pushed me, hey, as long as your body will allow you to do it, keep doing everything you're doing. If you feel yourself getting dizzy or lightheaded, then your body will tell you when you need to rest. But he just kept encouraging me, just keep doing what you've been doing. Don't allow the treatment or the diagnosis to control you, because if you get conformed to being in the bed, guess what? All you want to do is be in the bed. But while I was commuting, yeah, it was hard. It was challenging. By the time I come home in the evenings, all I want to do is sleep, which my body needs it. I've been up since 6 o'clock, drive an hour to Columbia, work 8-9 hours, driving another hour, 12, 14-hour days. Right after having treatment, I have to give my body rest. So I went from having 14 hours of chemo in 2 days to now my treatments only take me about an hour, hour and a half. But chemo is chemo regardless of how long the treatment is. It's still poison that's coming through your body, that's tearing your good cells or your bad cells, and it does make you tired. The dry mouth, the chemo brain, the diarrhea, the constipation. You just don't never know what you're going to get after that treatment. So again, it's different for everybody, but we need the support. So like for people like Travis that are independent workers, self-employed, we need more resources. We need people to fund. And y'all already know I'm a realist, and I'm gonna just say this. I remember the year I got diagnosed. Y'all already know everybody's familiar with GoFundMe. Our culture does not support those that are going through. I remember when I was diagnosed the same week as a classmate of mine of a different race. We both had a GoFundMe page went up at the same night. That next one, this chick had almost $50,000. James asked me how much did I have.
I don't want to be embarrassed.
I have 500, and then people wonder why I gotta go to work every day and why I had to get a part-time job. Because I'm just like, we don't support people when they're going through, and then when you work, it's like you got to be below poverty, like struggling to get assistance, or for people to support you.
Yes.
Like, to look sick or like you got cancer for people to support you or whatever like that. I just think that is so crazy. That's why every opportunity I have, if I got $20, I'll give you 10. You gonna have 10, I'm gonna have 10. Because I'm so seized not only into my health and my healing, I understand how the Bible works, and I understand where people are going. So I'm looking for opportunities to sow into others, so that God in return, even if He don't bless me financially, bless me with a healing. I take the healing over the finances.
Amen.
So with our culture, we have got to do a better job with supporting. People tell me, oh, well, go to the American Cancer Society. I done tried all those places. Susan Coleman, I done tried it all. Don't qualify. I don't qualify. So what are we supposed to do? We don't have a choice but to work.
Yes, and just piggyback off what you said as well. I remember that they gave me the pamphlet with all the phone numbers on it to call and say, like check them out for assistance. And I think those people made up and I don't know if it's an excuse or they just didn't have it, but it was just crazy. Like I was trying to be proactive. So I was telling them I'm trying to be ahead of things. I was going to be out of work for 6 to 8 weeks. I'm a homeowner. Bills are still going on here. I own a salon. Bills are going on. And so it's double the light bill, double the water bill, double the internet bill. And I was calling them and asking for assistance. And they was like, we could assist you, but do you have any final notices? And I was like, no, I'm trying to be proactive. I'm asking for help now because I know what's to come. I know I'm not going to be working. And then it was your cancer needed to be triple something or triple negative. I forgot what the woman said, but however, it was like every excuse in the book not to assist and or help. And that began to be a bit, it kind of was like a letdown because I know that I have donated to certain foundations in the past. And I thought that of course, they help out it will come back full circle. But the help that I even received wasn't even from the people that I donated to. It came from other places.
So I will jump in and say that I want to listen everybody that's listening. You can do something, and it doesn't matter until it's you. I'm listening to Tamika and I'm listening to Travis, and I'm an advocate. It doesn't matter until it's you. So you can do something. You can volunteer. You can give to these organizations so that they won't have every reason to say no to somebody who is in need. I listened to Travis a minute ago. They wanted you to have a final notice and red letters on the door before they would give you any money. That's why I'm trying to talk to you. So I won't get one. And then that added stress. That's why we talked earlier, James, about these organizations and why it's so important to have a community of support. This is why, because it doesn't matter until it's you. So I would say to anybody that's listening, get involved. Do what you can. When you hear these walks going on, and you see Tamika and I, we have on pink because this is Breast Cancer Awareness Month. There's a reason that we're raising this awareness. There's a reason that we're having this meeting tonight.
And I'm gonna say this: there's, with doing the support group and being a part of this journey since 2015, and officially starting the support group 2018. There's too many people in graveyards that shouldn't be there. Wow. Not because cancer took them out, because they gave up, because they didn't get the support they need. I mean, it broke my heart to hear one of my breasties say, "I don't want to be a burden anymore to my family and friends. It's getting too much." And that no one can never understand how that makes me feel, to know that somebody left this world because they felt like they weren't getting the support they needed. That's devastating. And she wasn't the only one. It's been numerous people, even with the people that I've come in contact with, the friends I've made in Atlanta. It's been a struggle for some of them to travel to get the best care, to where they just gave up because if people don't understand, we're fighting more to get help than we are fighting to live and get through the cancer, and that's just crazy to me. That is
real time.
It's crazy, the stress and the unnecessary stress that cancer patients have to go through, more with non-cancer stuff than it is with the cancer. And like I said, I know firsthand and I've seen firsthand, people have left this world and in graveyards that shouldn't be, not because of the cancer, because of the lack of support and resources and finances.
Yeah. And to piggyback off of what you just said about the support, my dad is currently battling stage 4 prostate cancer. And I remember us having a conversation about a couple of weeks ago because they have him on a hormone therapy drug as well. And my dad is he's a real prideful man, you know. He don't really ask for much. It don't take much. And I think that he had began to feel as if he was a burden as well. So he was actually considering not going for further treatment. And I remember just taking a moment, because sometimes we have to affirm people and speak life back into them. And I really had to affirm my dad, you know, and let him know that you're not a burden. This is an honor. It's an honor for me to get in my car and take you to your doctor's appointment. It is an honor for me to sit in this doctor's appointment with you and hear what needs to be here. It's an honor for me to help aid you in your decision making. Now, whatever decision that you choose to make, trust and believe I'm going to be with you 100%, because it's your body and you only know how exhausting this process and this journey could be for you. But however, I want you to understand that I want you to fight for as long as you can. But needless to say, just in that conversation, he decided he's going to continue to fight. That's why it's so important, you know, to have support.
It really is. And let me just say real quick, for the men that are listening, we're talking about men and we're really talking about breast cancer. It's not a brave thing to not go to the doctor. You know, like I said earlier, somebody else said, well, I haven't been to the doctor in years, with an element of pride. The manly thing to do is to go to the doctor and go take care of yourself. You know, it's cowardice not to go, in my observation. And you can, you know, send me hate mail. I'm on LinkedIn and everything else. Send that to me. It's cowardice not to go to the doctor. Go take care of yourself. You've got family and loved ones to depend on.
Yeah.
Wait, stay right there, Brother Rodden. Why do you think many men don't go to the doctor?
I think they have the script flipped. I think that they think that it is a manly thing not to go, but it's brave, it's courageous to go and face whatever circumstances there are. A lot of times we don't want to hear what the doctor has. I used to be that guy. I will confess. I used to be the guy I was dreading when Dr. Hamayan would come back in there, and I'd hope he'd say, you know, keep your cholesterol down, eat some oatmeal, and get out of here. And I didn't want to hear him say anything else. And after a while, no, I want to hear the other things. But to answer your question, James, we have the script flipped. We think that it's brave not to go. And we're big men. We don't need to go to the doctor. No, you better go see what hear what you need to hear so you can keep driving that truck.
And we're the complete opposite. I know the doctors are, oh Lord, here she come again. Yep. I don't care what it is. If it hurts, I need to know why it hurts. We go to the doctor for everything, the least little thing. I know I do that. They be like, oh Lord, here comes Miss Tamika again. So, but yeah, I mean, like I said, I think it's a male thing. Because even my 16-year-old son, why I gotta go to the doctor? Ain't nothing wrong. Boy, you need to go get checked out. You try to stay proactive, you know. You still gotta go get checked out.
Yeah. And
don't have that issue.
And Tamika, how old is your son?
He's 16 in 11th grade. Yeah.
Wow. Okay. Yeah. And I don't know if y'all know or not, but I was when I was looking up some stuff about breast cancer, men breast cancer, the youngest diagnosed was like 17.
Wow. Okay. Yeah. What's in the world?
And he was he found a lump in he found a lump in his breast and went to the doctor, and it went misdiagnosed. And so I think by 18, that's when he found out it was breast cancer. So even, like making sure that we talk to our younger generation of men as well to do examinations to make sure that they are in the clear, or if they notice anything, they can catch it. Early detection.
Early detection save lives.
Absolutely. Yeah, absolutely. Because, I told him, he was like, I said, no, we're going to get a physical. And I said, we're going to do a complete blood panel to make sure, everything is done. Because, just having your blood levels, your things, it'll throw everything off, and it create issues. So I'm teaching him at a young age, once a year, you get a physical, let's check your blood work. I told him I want a full blood panel. No, we checking everything to make sure
everything.
Because, we know now things are different from when we were growing up. Our kids are exposed to a lot more things. There's a lot more going on, so we got to make sure, that, they're healthy, Because at the end of the day, kids at school, we don't know what our kids doing at school, what they're exposed to, and things like that. We
Yes.
had vaping and all this stuff when we were growing up. We had the marijuana and stuff like that, but they take things to another level now. They got vaping and all kinds of stuff. And I'm just like, we didn't hear that growing up. So I'm just like, and these kids are they're lacing this stuff. It's sad how many young folks are in hospitals and mental hospitals because kids are getting a hold of these things because they're doing it because everybody else doing it and they're lacing it with things and they don't understand what it's doing to their body. I told my son, I said, trust me, you don't want to go where mama go every 3 weeks for lung cancer because you wanted to vape when the 8th grade and 9th grade and do these things that you had no business doing because you don't know these things, what they're making them, and then by the time you get it from somebody else, you don't know what they put in it. So there's a difference in today.
We got a couple comments. Glamour to Go Beauty, she says 100 on it. Nicole Hall said that is amazing. It is important for both men and women to be aware and proactive. And said also that women need to know how to do self checks in the shower as well for early detection. I'm sure that there's some type of a YouTube clip or some type of pictorial that will show an individual how to do a self check exam. And Glamour Glow Beauty, she affirmed that and said it is a must nowadays. All right, ladies and gentlemen, we're getting down to the end of the show. Once again, thank you guys all for coming in. Any last words or comments from you, Rodney, Long Island Iced Tea guy, Tamika? What's going on with you?
Let me just commend I want to commend you, James, for having us. And the Manversation was wonderful. Tamika and Travis, be encouraged. And you're not by yourself.
Appreciate it, man. Thank you.
Like LLS, the American Cancer Society, Sisters Network of the Triangle. We got you. You're not alone.
Thank you.
Amen. Appreciate it, man.
Thank you.
Tamika, Trav, because I'm about to cut this off because Lord, I was about to be crazy and I was about to say, man, hey, look, I'm about to do me a check, but man, I ain't gonna do that.
You gotta go ahead, James. Yes, sir. That's what it's for.
Yes.
Yeah, man. What's going on? They got me thinking. I gotta check it out.
Oh my goodness. Well, James, thank you so much. It has been a pleasure being on here tonight with you gentlemen. I pray and hope that it has been a blessing to someone. If you want to know about our nonprofit and our support group, you can reach us on our website, wearefaithstrong.com. Of course, this is Breast Cancer Awareness Month. We just had our big annual fundraiser last week, Pink in the City, where we also featured Travis, our first male breastie, who shared his testimony, and also that brother can sing. So if anyone would like to support us and give a donation, we would love your support. And you can go to our website to learn more about us and how you can donate and the things that we do in the community regarding breast cancer.
All right, guys. And I am Travis once again. And thank you so much, James, for having me on and allowing me to share my story and my experience. If you guys want to reach out to me and speak with me personally, you can go and look me up at travisbernarddouglas.com. All my information is there, my phone number, everything is there. And or hit me up on Instagram, Travis Bernard Douglas. You can inbox me or call me. And if you need to talk or have any more questions that you need answered, just reach out to me.
Awesome. Thank you all for this engaging and enlightening conversation. It's essential to break the stigma surrounding men and breast cancer to support those affected. To our listeners, remember to like, share, and subscribe to our page. Leave your comments and questions below, and we'll be sure to engage with you. Thank you once again to our incredible guests, Rodney, Travs, and Tamika, for joining us today. Let's continue to spread awareness and support for this crucial cause. Also, check out the Let's Have Manversation.com webpage, where you can go to that little button over there, click donate to other great pursuits such as this and all things related men. Once again, thank you guys for tuning in. Man, Godspeed. Fellas, make sure you do your little breast cancer checks. Whatever you that couple of
That's
whatever.
right.
There you go.
That's right. That's right.
Y'all take it easy. Godspeed.
Right.